In terms of the educational workshop, it's really designed so that families who have little information about the illness get that information and have it available to them so that as we go forward they can recall it, bring it to play in their daily life, and begin to really become quite sophisticated in how they approach this illness. Just practically speaking, the educational workshop is usually held as a one-time 5, 6, 7-hour weekend day that is scheduled after a group of families have had at least 3 joining sessions. The leaders are the leaders of the group, and they present information in an open, collegial manner, encouraging families to ask questions and have a fair amount of interaction amongst themselves and certainly with the group leaders. We usually make sure that a psychiatrist who is treating the consumers in the group also has an opportunity to share a lot of the basic biological and psychological information about the illness and the medications themselves. It's the first occasion that the families actually meet other members of the group, as well as often the other practitioner who's co-leading the practice with their own partner. It is designed to be a social occasion, not unlike joining, where we socialize and eat together as a very important part of the day. In general, the agenda is divided roughly into 2 parts. That is, the morning is spent on kind of clinical and technical information about the psychobiology of these illnesses, how the treatments work, what kinds of treatments are available. The afternoon really focuses more on the family's experience and the consumer's experience of these illnesses. And it really closes with probably the most important part, and that is a set of guidelines that families use on a day-to-day basis to compensate and overcome for the difficulties of these illnesses. So that's the basics of the psychoeducational workshop. Please refer to your printed materials, especially the book, to see the whole approach and the details of the curriculum.